My name's Jeff Ross. I'm a physiotherapist and the director of Harris Ross Physiotherapy here in Winslow. We've got clinics around the northwest, and we've got around about 20 odd physiotherapists, massage therapists and podiatrists that work with us. I guess we're in a very privileged position as medical professionals where we get told a lot of things by our clients. They tell us a lot of things about their general health and well-being. They will tell us how they're feeling on a day-to-day basis, and they might have come in for a back or a shoulder or a sore knee or something, but there's still a lot of questions that we ask them initially in terms of their general health as well. And sometimes we will pick up some red flags there in terms of something not quite sitting right in terms of their history. And we do have to, for example, if we're looking at someone's back, we need them to take their shirt off so that we can examine their back properly. And the back, for example, is an area where they won't see the skin on their back, and we can see that. And another example would be a foot or an ankle. Again, if someone's hurt their ankle, and we have to look very closely at that, and we're looking for things like swelling and bruising and any sort of discoloration, and you do, because you're looking so closely at these areas, you tend to see any little spots or lumps and bumps, and we can ask the patients whether that's something that's new, or did they know that was there. And so we do get a really good opportunity to look at people's skin in places where they wouldn't necessarily look themselves. Yeah, I've done the accreditation, and I think it's fantastic. It gives you a greater understanding of the, I guess, more the dangers, and reinforces the seriousness of what can happen with skin cancers, and the ability to understand what you're looking for as well. And I think once you've worked your way through that accreditation, all the pictures are very, very good and very clear, and there's a number of different skin cancers that we can see, and so I think once you've worked your way through that accreditation, you'd have a much better understanding of what you're looking for, and I think feel more comfortable as well giving people advice. Absolutely. We're going to, over the next few weeks, get all of our staff accredited, and I think it's really important. I think to an extent, I think we've got a duty of care, and I think if we didn't have that understanding, I think we could be missing things. So I think all of our staff are very keen to get the accreditation done and provide that extra support to our clients. You know, I'm from New Zealand, so I grew up there, and the sun over there is really strong. It's a little better now in terms of the ozone layer, but when I was growing up, the ozone layer had a massive hole in it, which pretty much sat over New Zealand and parts of Australia. So our UV rating was very high, and from a young age when I was growing up, it was drilled into you that you put a hat on, you put sunglasses on, you covered up outside, and you wore sun cream. Whether it was a sunny day, a cloudy day, summer, winter, and that's just become even more important over there. And I think the general understanding in the Southern Hemisphere is one of being very, very careful in the sun, and not just going out and lying in the sun, sunbathing. And if you are outdoors playing sport or working outdoors, that you cover up and look after yourself. And I think probably what I've seen over here is that the general understanding is probably not as good. Possibly to an extent the weather doesn't help because of the rain and the cloud. People think that, you know, I'm not going to get sunburnt, but actually over here the UV there's days where the UV rating is very high, and often not necessarily on a sunny day either. Cloudy days are just as bad. So I think you know, they're probably, UK is probably a little bit behind the Southern Hemisphere, but I think things like this are brilliant, because that's going to help the UK catch up.